I like going at the end of the first round of questioning because you get to hear all the conversations. And this is an interesting topic to me. My dear old father is still upset with me for not taking a job with IBM to help them build databases. So this is something, it's a topic that's near and dear to my heart. And I talked about my opening frustration, and that frustration is still here despite all the testimony. And my first question, Ms. Melvin, you've alluded to this and you've answered that, but I'm going to ask this question again. Who is in charge of interoperability of electronic health records between DoD and the VA?
At this time, the Interagency Program Office is designated as the single point of accountability. However, what we do know at this point and what we've reported is that VA has its own governing body, I think as Ms. Counsel has alluded to, and also DoD has its own governing body. So there actually are at least 3 different entities that are involved with this.
Thank you. That's helpful. Mr. Miller, you represent the IPO, is that correct?
Sir, I represent the Department of Defense as a senior executive responsible for both our interoperability and our modernization efforts. The director of the IPO is Dr. Lauren Thompson, who reported back in May, and she actually runs that office.
So is that Dr. Thompson? Right?
Yes, sir. So she reports both.
Do you report to her?
No, sir. She works for me and under Secretary Kendall.
So you're her boss?
Yes, sir.
So, but you're a DoD employee?
That's correct, sir.
So who is this governing body within DoD that is looking about this the interoperable medical health record?
So within both departments, they have their own IT acquisition organization. So within the Department of Defense, that's under Secretary Kendall. He's responsible for all of our acquisition. And so on the acquisition and technology side, he is who we report to on our efforts with interoperability. The same goes on the VA with Ms. Counsel. What we do is we routinely meet between Ms. Counsel and Secretary Kendall to review our progress.
So my question, Mr. DeVries, a clinic, a VA clinic, and let's just say San Antonio, can they have one computer that has access to the VA health system and the DoD health system?
They could, sir.
Do many people have access to that?
Not today.
Trick question.
Not today.
Okay. Why is that?
I think it's based upon technology, where we are today, and where the data is. Identity is the critical part here, as I talked about before, from both the patient as well as the provider.
Right. And you're responsible for that, correct? Providing the accesses and the protections around that data, you specifically?
Correct. Overall policy is, yes.
So if Mr. Miller, can Mr. Miller tell you what to do? Is he in your chain of command?
He is not in our chain of command.
So the person that's responsible for protecting the data, right, of our health data, right, which is a key part of interoperability, the person who's charged with interoperability does not have control over those people making those decisions. Is that correct, or am I confused?
Sir, I would offer there's checks and balances. So my job within the Department of Defense is to lead the acquisition, the testing, and deployment, but I have to get approval from our CIO organization to make sure it meets security requirement. We're protecting data. So it's a partnership. There's no single, if you want to get up to the very senior level, but day to day, I can't do anything without him, and obviously they have to have something that we provide in order to assess our security and how we're doing at protecting people's information, sir.
So, Mr. Miller, you said this is a national issue about interoperability of healthcare records. I agree with you, and I also agree with Mr. Conley as well. This is about 2 federal agencies sharing information amongst each other. And to me, it's shocking that a doctor in San Antonio, Texas, can't have one computer on their desk that accesses both the DoD records and the VA records.
Sir, he can, and I would love to take.
But they're not. Look, so how many doctors, how many DoD doctors and how many VA doctors have y'all talked to on the implementation of this system and what they need in a interoperable electronic health record?
So let me talk about the requirements when we do interoperability. It is jointly led by easily, 20 or more clinical leaders from both departments. And so today in San Antonio on the DoD side, we provide access through what we call JLV, but it's actually integrated
Yeah,
in EHR.
and let's get to JLV.
So, sir, sir, let me just explain. It's in our EHR. It's inside of Alta. There is access to be able to see the VA data and the data from the private sector. That is available to any DoD physician, PA, nurse.
How do they gain access to it?
Who
Who do they ask? If I'm a doctor, how do I gain access to be able to see both records?
So to be able to see both records, all they have to do is go, just like any other IT system, they go to the local administrator, they grant them the keys to access the system. We've gone in the DoD from about less than 500 now over 8,000 in about 6 months, and we are continuing to roll out.
And this is for JLV?
Yes, sir. In fact, at Brooke Army Medical, it is one of our largest users and actually where we've been doing the operational test. So besides getting input back on the requirements side, we've actually gone and done operational testing at Brooke Army Medical in Alaska and at Walter Reed to get feedback from no-kidding users, which has then been rolled into the future enhancements of the system. So we have an incredible engagement with our clinical functional users to make sure we're meeting their requirements.
But a soldier, sailor, airman, and Marine, when they show up to a VA clinic for the first time, they still have to print out.
No, sir. I talk to people routinely.
Okay, so let me ask you. So you're saying nobody has to do that?
So, sir, they print that record out because oftentimes our active duty, especially when they have been in the service a long time, predate our IT systems. So I think it's important to recognize that we have not been fully electronic within the entire Department of
Look,
Defense.
absolutely. So here's the problem. Quick question, and Mr. DeVries, you may be able to answer this question for me. If I'm in the Air Force and I go see a DoD doctor, is my record different than someone in the Army that goes and sees a DoD doctor?
It is not.
It is not?
It is not.
Same system.
Same system.
So all branches, is it, okay, Air Force, Army, is it the same for all branches of the military?
Yes, sir. Same
Yes.
system.
It writes to the same data repository.
Will the gentleman yield very
Yes,
briefly? I
please.
just have a little something.
Please.
So I don't know if the gentleman is aware of how frustrating this is when there's even a hospital in Chicago called that is a joint federal VA DoD facility, and in that hospital they actually have two computers sitting next to each other, one with the VA system and one with the DoD system, and that hospital is supposed to be a joint facility treating simultaneously veterans and Navy personnel. And even there in the Hallmark hospital that is the flagship of this effort, it's two computers sitting next to each other. Shameful.
It really is. So, who's actually, so I look at this problem multiple ways. You have the various health facilities that a soldier, sailor, airman, and Marine may see in their time when they're in DoD. Then you have all the facilities within the VA. Then you have if a veteran has to go to a private a private healthcare provider. It's a whole nother set of issues with interoperability, which I recognize the complication of that. Then you have people that starting today, brand new, starting basic training in these new systems and their lifetime. Then you have the people that have already been serving, that have served for 30, 40 years, and they have a number of old records that are in legacy systems that are super old and outdated. I get that. But what we haven't heard from any of this is what is the plan to solve those different problems sets? Right? And we talk about mapping data. Do we not know what the format the various pieces of data are in? Do we not know? They're all basically databases, and we know how many fields they are. There may be thousands of different fields, and each field may hold it could hold text, it could hold imagery. I get the difficulty of that, but we should already know what that mapping scheme is. And in order to do the map from DoD to the map to the VA system, why has it taken 4 years and $536 million to do that? And then everybody throws up their hands and says, "Our bad." this is really hard to do, and we're going to have to go through separate systems. Now, I recognize, I don't think anybody on this panel were around in 2008. Mr. DeVries, maybe you were. No? Oh, good. Not around, but you weren't involved in this. So first step is, have we gone back and looked at the problems as this was solved, right? And Ms. Counsel, I know you're new, and I'm excited about you bringing some expertise and experience from the private sector. I don't know if you knew what you were stepping into when you took this job, but we're glad you stood up and willing to take on this challenge. But we have to look at the failures in the past, and I'm sorry, 2 years is not acceptable. And saying that, you know, I wasn't around. When we're talking about the FY14 NDAA, and that we're going to comply with that requirement, but at the end of this month, our soldiers are not going to be able to walk into a VA system and get access to their DoD record. They may be able to see it in JLV, but JLV is the equivalent of using microfiche. And you may be able to search for an individual patient, but you can't search what was their blood pressure. And sometimes you having to have VA clinics do the same test over because they can't see the imagery that was included in their DoD system. That's a huge waste of time. And what's shocking in all this, the men and women, the doctors, the healthcare providers in the VA and the DoD, they're doing a damn good job, right? When they're actually providing that service, and they're the ones that are having to get these workarounds for their system to make sure that they're providing the kind of health care that our soldiers, sailors, airmen, and Marine have. Now, my last question, I'm way over time, and I apologize. Ms. Counsel, do you have all the tools, authorities, in order to do this job?
I've had this conversation with my team. I think it's the first time in my career I can say yes.
Well, excellent. If you need more, let us know.
Will do.
And with that, I yield back.